evening, and welcome to the September 9th, 2024 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn?
Dan Finn here.
Karen Gustowski-Govin?
Karen Gustowski-Govin here.
Bill Muller?
Bill Muller here.
Thank you. Staff and anticipated speakers on the agenda, when I call your name, please respond in the affirmative. Nancy Connors?
Nancy Connors here.
Thank you. I don't see Beth tonight. No Amelia, no Ian. Molly Scannell?
Yes, Molly Scannell here. To clear up some confusion, my name is Melissa, but I do go by Molly, so it's both.
Devon Thornton?
Devon Thornton here.
Thank you. Cherry Tangri?
Cherry Tangri here.
Thank you. And remind me, Jennifer, are you with the Alliance?
I am. I'm here because Ian is on vacation.
Perfect.
Yeah.
So Jennifer Nakajobi.
Jennifer Nakajoba.
Great. All right. I would like to open the meeting. Can I get a motion to open the meeting? Dan?
Hi, two hands. This is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Bill Muller. I'll second Dan's motion.
Roll call?
Dan Finn, aye.
Bill Muller, aye.
Karen Gustowski-Govin, aye.
Jen Maynard, aye. All right. Just let me read to you all and then we will get started. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st, 2025 of the remote meeting provision of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, in which you can find posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meetings. For this meeting, Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference, all of us. Accordingly, please be aware that other folks may be able to see you and to take care not to share your screen or your computer. Anything that you broadcast may be captured by the recording. Meeting materials. Any supporting materials have been provided to the members of the body and are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on our agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes on any motions made during this meeting will be conducted by roll call vote. All right. Here we are. I'm going to turn it over first to our friends at the Alliance for their update. Who'd like to go first? Cherry, maybe?
I can go, yeah.
Go ahead.
So for the opioid subcommittee in Grafton. We have been meeting monthly, and the last meeting happened on August 27th. So the discussion that happened in that meeting was about bringing in more community-based members to join the opioid subcommittee. The members suggested that because Jay Cummins, the school superintendent, was on the meeting list, and it was like, we know he has a lot on his plate, so it was suggested that he appoints someone as a school, somebody from the school representative to come attend those meetings, and so that we have updates from schools in terms of what is going on regarding the prevention work, so that we are able to align all work in the town of Grafton, and it's not just limited to the schools or just limited to the subcommittee, because this is in reality working for whole of the town of Grafton. And so I did make those connections, and we have a representative who will be attending those meetings. She's Roseanne, who is the school elementary school principal. She already is doing the what's it called, school committee wellness advisory meetings. She does facilitate those meetings. And then I was able to reach out to church memberships to join this committee, and I did have one person who will be attending the meeting, and also I'm trying to reach the other sectors such as library, and looking at if Grafton has a parks and recreation department. So that's still work in progress. On another note, the part about the proposal, the members in the subcommittee had voted to continue to bring in the DARE program within what the chief of police proposed. So that was voted on as yes. And then the other things are that group is going to was interested in doing Narcan trainings, and one has been scheduled for October 23rd at 6 o'clock, and the admin at the police department, Marianne DeVries, she is helping coordinate those trainings, but we already have everything established. Yeah, not much on that. And then I also reached out to the admins to just make them aware that the town is able to have their own Narcan supply and have a control on the distribution, and they do not have to any longer go through us. So if there are any questions. Yep.
Yeah, this is Dan Finn. Thank you, Cherry. And just to add to what you said, Chief Crapo did have a written proposal for a grant, and which will involve the monies will go towards increasing the DARE program, perhaps at different grades, but also being available for overtime pay for some of the officers that do follow up and counselors. There's a whole list of things that they already do, but to sort of boost the existing prevention and counseling. And it was the amount of $7,500, $7,500. I don't know that it's been awarded by us or voted on. I don't know. Ian and Mary, we're going to work out the details of how that happens. I think it's going to be on an as-need basis, but that was the amount that we awarded at the last meeting.
So do we have DARE currently? And if so, what grades does it serve?
We do, and I believe it's the elementary grades. I'll have to check for sure, but it has shown to have been successful, actually, looking at the surveys that have been done over the past 6 or 8 years. And, but he's talking about expanding it perhaps a little bit younger and a little bit older by a year or two.
Good idea. Great. Any other questions or comments for Cherry or other subcommittee members? Great, thank you, Cherry. Who's next? Welcome, Soleil.
I can go next. As you all know, Cherry used to be the tobacco public health specialist, but now she's the shared service coordinator. So we are interviewing a few folks for that position, the tobacco position. We are in the second round of interviews currently, and we hope to have somebody on board by end of September when it comes to tobacco retailers in Grafton, to be able to have somebody to come out to do those inspections and education within Grafton. So somebody will be on board very soon.
Big shoes to fill.
Yes, for sure, for sure. So whenever tobacco is an agenda item on the Board of Health meetings, we'll have somebody new hopefully by end of September.
Wonderful, thank you.
Yep.
Who's next? Molly, Melissa?
Hello, this is Melissa Scannell, or Molly. I just have some nursing updates. First, we'll start with COVID updates. COVID numbers continue to rise. For the month of August, there were 30 reported cases, and it's a little skewed because it's test results that are reported in a PCP's office that went through a lab. We all know that most people are testing at home, tests that they've gotten from the pharmacy, those are not included. So as far as lab result testing, we have 30 reported cases for August, and then which is up from the 20 that we had in July. And then the wastewater summary, according to the BioBot analysis, reflects the same increase, and that the numbers are in fact climbing. This could be due to, end of summer programs, school starting, things like that. Hospitalizations mildly fluctuate weekly. Masking and vaccinations are still the best protection at this point. The new vaccines are out, and they're out from Pfizer, Moderna, and Novavax, and they protect against the current variant. All age groups are encouraged to get it, including pregnant people. Our records show that it is available at the CVS in North Grafton at 104 Worcester Street. So we can see who carries it, and that CVS definitely has it. Other vaccine news, all age groups are encouraged to get the 2024-25 flu vaccine in early fall, around this time, a little later. Those 60 plus should consider getting the higher dose formulation and it's formulated for people of that age group. All infants less than 8 months old are encouraged to get their parents are encouraged to get them the RSV vaccine. Infants 8 to 19 months old who have risk factors, and this is immunocompromised status, things like that, are encouraged to get the RSV vaccine. Again, adults 60 to 74 who have risk factors are encouraged to get RSV, and then just adults 75 plus, RSV is a good idea. It, for transmission and so that it's less serious if they do contract it. Pregnant people 32 to 36 weeks along should consider getting the RSV vaccine, and this is provided by Pfizer Abrysvo. It's the only one that is safe for pregnant people. And it's formulated for them at this time. So we have 2 clinics planned in Grafton. One is this Friday on September 13th at the Grafton Middle School. And that clinic is offering all school vaccines, including the tetanus, diphtheria, pertussis, the Tdap, and the DTaP vaccine, the meningococcal vaccine, MMR, HPV, hepatitis A, hepatitis B, as well as flu and COVID, which are not, required for school admission, but we're offering it too. And then there's another clinic on September 27th, and that's being held at the Municipal Center Gym. And that clinic, we're offering flu 65 plus, shingles, which is a 2-part vaccine. So we'll do another date 2 to 3 months later, just to get people that booster. And then we are also offering RSV and COVID for adults. And this clinic on the 27th is a town-wide clinic for all Grafton residents. And town employees, I've gotten this question. I just want to make it clear that anybody can come to it. Town employees who don't live in Grafton are definitely welcome. You can call me on the flyer. My cell phone number's there. I can sign you up easily. Hopefully we'll get a lot of people. I've gotten a lot so far, so that's good news. Arbovirus updates. The season is June to October, so we're in it right now. There are no cases of West Nile in Worcester County. There was 1 case in the month of August for Triple E, which is Eastern Equine Encephalitis, and that's in Worcester County for the month of August. West Nile and Triple E risk level is moderate for Grafton, and this just means that a case occurred in our area within the last year, and or there was mosquitoes found with it in the area of this year. So that's what constitutes our moderate risk level. Suggested preventative measures include repairing window screens, wearing mosquito repellent between dusk and dawn, and when outdoors for just longer periods of time. Wearing long sleeves and long pants, again, when you're outdoors for longer periods of time, especially dusk and dawn. Using mosquito netting on baby carriages and playpens, and avoiding outdoor areas where there's like obvious mosquito activity. Other updates include the international Mpox outbreak, includes 13 African countries to date, but no one in the US has been affected during this specific outbreak. Currently, Massachusetts is experiencing an uptick in pertussis or whooping cough cases. And pertussis, it's a bacterial disease that is usually mild in older children and adults, but it can be dangerous for younger children. So to protect against it, we're encouraging vaccination, of course. The DTaP vaccine is for children under 7, and the Tdap vaccine is for children and adults over 7. It's like in the tetanus vaccine. So if you've gotten a tetanus shot, you probably have gotten the pertussis, same with children. And both will be available at the clinic this Friday on September 13th at the middle school. Blood pressure and file of life clinics continue at the Grafton Senior Center and the Housing Authority on Forest Lane. And the topic of the month for August was foodborne illness, and the topic of the month for September is pertussis. So we have that rolled out. We're good. So any questions?
Just a couple things to, I think, double click on. Thank you, Molly. Lots of good things happening. For COVID related, Nancy, can you remind us, do we have test kits available still in the office for folks that might be looking for them?
Yes, we have many.
Great, I thought so. So worth noting if people are looking for access, to let them know that we do have them at the office. If we haven't done so already, you might have already, but we should probably post on our social medias and our website about the upcoming clinics, especially the one at the municipal center. Molly, you need them to sign up beforehand?
Yeah, they are taking insurance, especially for the shingles and RSV, flu and COVID. We can take, pretty much a lot of walk-ins, but most of it is just so that the signups are required, just so we know how much vaccine to bring.
Sure. Yeah, of course.
Yeah.
Great. Let's see. Triple E, just worth noting here, for folks that listen later, that, when we have had positive samples, not necessarily positive individuals in the area, we do work with the folks that do the spraying in the area and increase the spraying in certain areas just to, again, try and mitigate the risk alongside all of those interventions that Molly described. And I think those were my sort of double clicks on those items. Anybody else on the board? Questions, flags? For interested parties that might listen. Great. Thank you, Molly, and welcome.
Thank you.
All right, is it Devon next?
I think it is. Congratulations, Molly. I guess I'll start with complaints. We've had 6 complaints from since the last meeting till now. If you would like me to read them off, I can do that.
I don't think you have to read them off, just if
Okay.
anybody on the board have any questions on the complaints that came in.
Okay. We also, oh, Dan.
Yeah, thanks. Just one about the Cumberland Farms. You had another busy and somewhat nasty month, I'm afraid. But typically the Cumberland Farms don't allow the public to their restrooms. I'm thinking that must have been some, delivery person or whatever, but I guess the staff was aware of it and cleaned things up, and that part's good.
Well, I think the public actually is allowed to use the restrooms. This was like an early morning incident where it was in between staffs changing over in preparation to clean the bathrooms. The restrooms, they clean them like 4 to 5 times a day.
Okay, yeah.
This is an early morning incident. They hadn't gotten to it yet. The customer was a bit upset. When I actually got to the restaurant, they had already cleaned it, and they were in the process of doing a follow-up cleaning, I think for the 3rd time of the day when I was there.
Yeah, that's good. I think generally they're a pretty good outfit in terms of cleaning and stuff like that. So.
That's one of the cleanest Cumberland Farms, actually.
Yeah.
I have to
Okay.
inspect.
Thank you.
You're welcome. Let's see. Food inspections. There were 13 food inspections this month, 2 body art inspections. We've had 1 component inspection at 44 Adams, 2 Title V inspection report reviews at 5 Maple Road, 4 Towbridge Court, and 7 Susan Terrace. Maple Road was a pass. Towbridge Court was a pass. Susan Terrace needs a D-box and 2 well permits. And we have 2 disposable work installer tests. And that is it for me. Any questions?
Like Dan said, another busy month. Any questions for Devon? I know we'll probably talk to you again on another item on our agenda, but thank you, Devon.
Okay, you're welcome.
Miss anybody from the Alliance? I think I had the updates from you all. All right, it's my agenda. All right, so moving on, in our packet, we have a letter from Elder Services of Worcester on behalf of the Senior Center at here in Grafton. They are requesting a variance to 105 CMR 590.000, which is the sanitary code for food establishments, and 105 CMR 59.000, another section. Essentially, they are looking to not have to go through the same certification process of having a food safe handler on site, because the letter indicates that they do state level reporting. They essentially use, it seems like Meals on Wheels, and bring that to offer services at Grafton Senior Center. So they're asking for a waiver of that requirement and to essentially allow them to do the state reporting mechanism, is my understanding. Do I have that right, essentially, Nancy, before I do some follow-up questions I had posed?
Yes, that's correct.
Great. So they have something, right? They have one portion of it already at the Grafton Senior Center, but not the sort of the certification for like the allergen and all those different things that require with the food service. Is that right?
Well, they have a food handler, but not food manager. Is that right, Devon?
Yes, that's right.
Thank you. So Nancy posed back from me to the senior center a couple of sort of follow-up questions. And I think what I would recommend, but certainly the board should talk through this a bit, is to follow up further with Elder Services of Worcester. If you're not familiar with Meals on Wheels, these are typically pre-planned meals that are sometimes heated up and sometimes they're, you know, ready to be put into the refrigerator, usually come with milk. They typically are being sent direct, you know, a driver is bringing them directly in a little cooler to a person's home. And usually that person takes it and puts it in the fridge, and they sort of take responsibility to reheat the item or refrigerate the item. And it's, you know, usually good for a couple of days. The follow-up questions that I had for them was, you know, are the meals something that are refrigerated? Are they cold meals that are being served right then and there? Or are they something that they're being reheated in a microwave or something and then served to folks at the senior center? I'm just not clear like how they're handing them out. And then of course, you know, what's the precedent in other, because I'm sure other communities are doing this, offering a meal at their senior center. So how have they sort of set the precedent of taking the state's sort of requirements and just applying it that way, and any reporting that they're doing from there? So my thought was that we should kind of get clarification from Elder Services of Worcester. It sounds like the senior center is sort of yielding to them to give us some answers on those sort of clarifying questions, but I'll pause. Does anybody else have thoughts on we should just move forward with this or get those clarifying questions answered to discuss?
Jen, did you see the email I sent out this morning at 8:30?
Yes, that's where I kind of thought it was that they were kind of deferring a little bit to Elder Services of Worcester about sort of some of those clarifying points. But that, you know,
Okay.
there's probably precedents in other communities, hence why Elder Services of Worcester is asking, I think, just to confirm, like, you know, they cite sort of the state's reporting, and that they basically don't double request of us requirements. And so we just want to confirm that we understand what that means, I think. Go ahead, Dan.
Thanks. Yeah, so as I understand it, the foods and the meals are actually prepared in Worcester, delivered to Grafton, and then distributed by Grafton volunteers or whatever. So, yeah, I guess there's a couple questions there that we should get clarification on, in my opinion, and just table it until the next meeting till we can get some answers to those questions. My opinion.
Yeah, because typically when you have food coming in, to have to oversee this for a site myself, and if they're coming in like a big tub, there's like temperature requirements and people have to be trained on all those things, and no reheating and stuff like that. But your typical Meals on Wheels are sort of pre-packaged. So are they like doling it out, or is it pre-packaged? And like we said, those kinds of follow-up questions. And Nancy, we can I'm happy to work with you a little bit on just sort of getting to the clear-cut questions that we want from them that we can bring back with the board, or anything specific the board wants to ask them.
And I'm willing, if needed, to, well, it was already my plan to speak with Elder Services of Worcester to find out what the goal was and to also speak with other town representatives as well, because this letter went to all towns
Ah, great.
just to see what they were going to do and a great way to approach it. So I actually have someone that I'm able to speak to that sits on a chair at Elder Services.
Oh, perfect.
So I'll get some information this week.
Yeah, that'd be great. I don't think we want any unnecessary hurdles for them to be able to offer. It's a great service to be able to offer at the senior center. We just want to make sure that we're doing everything we're supposed to be doing to make sure the food safety is in line. Great. Thanks, Devon. Dan, did you have something else?
No, just that it's possible that the state regulations regarding the manager might even be, more stringent. So we just have to find out.
Yeah.
And it's not so urgent. I think we could bring it up next meeting.
Sounds good. Yeah, I don't think this is a new food service program they're doing. I think they're already doing it, but they're asking for flexibilities now. It seems like that was sort of one of my questions too. I was like, did we send them asking for something, or are they? It sounds like it was a proactive outreach to some communities. Gotcha. Great. Thank you. I think we probably hit on everything around COVID, Tripoli, and West Nile. Anything else to share on those? Great. Opioid, we're good. Devon, you're always very popular on these meetings. Creeper Hill Road clothing bins. Any updates?
I am happy to say that issue has been addressed for about a couple of weeks now. I would have to thank Cindy and the town administrator for working with DPW to have those bins removed, to clean up everything. So that was addressed. Yes.
That's right. I think we talked a little bit about that last time that they were pulled. And did we say we found out that it's DPW that oversees those? Is that right?
No one, I found out that the city doesn't even permit them. The town, I'm sorry, Grafton doesn't even permit them. I think it's up to the owner of the business to allow the bins to be there.
That's right.
Yeah.
We just get the calls when
Yeah.
things go wrong. Got it. Great. Thank you, Devon. All right. 2025 meeting schedule. That Nancy always wants us to think ahead. So from reading the opening comments, it looks like we are okay if we wanted to do remote through March, right? But thereafter, we may have to consider hybrid or in person again, unless something changes. So I looked at the calendar, and so we've already got October through November, so maybe we can do, if you all want, we can do remote January through March, and then set dates April through June, and then just say tentative whether or not it will be in person, hybrid, or virtual. Does that make sense? Cool. All right, so for January 2025, I was proposing either the 6th or the 13th. I don't think we need a motion for these, right? We can just align on a date. I might not be available the 6th, so Karen, if you'll be here, it's probably okay. I may or may not be.
I should be, to my knowledge.
I know,
That
it
was
seems
me
like so
working.
far away. It's not that far
I'm
away.
like, woo.
So we'll do January 6th.
Yeah, like we always say, like we always have the opportunity if, we've done that rarely, but, hey, we know there's a conflict or like 1 to 2 people may have a problem. Well, let's move it once we know that.
Yeah, perfect. February 3rd or the 10th. Go for the 3rd, that'll give us some flexibility.
Yeah.
And March 3rd. And we'll plan for those to be virtual for now. And then I have April 7th. May 5th. And June 2nd. And then we'll TBD format for that. All right, hold your calendars. That was
Well, the
easy.
good thing with trying to get them in early like that is when you have those rarer, which don't always end up being rare, Monday holidays,
That's right.
other than like if you have July 4th or something,
Yes.
obviously.
I checked.
Or
the
Labor
calendar.
Day or something like that, that's earlier on. At least typically your other holidays are like the week after on a Monday or something.
Yes, I did check the calendar for holidays before that. Nancy, just let us know after you look at those, if any other boards have held conference rooms, just in case after March, we do need them, I would say.
Correct.
We learned that before, right? Go ahead, Dan.
I just want to mention Cinco de Mayo was somewhat of a holiday for some people, but if you like tequila. Anyway, never
Oh.
mind. Comment.
I mean, we can have the meeting at Cancun's.
Yeah, there you go.
That would be fun. But certainly we can adjust Cinco de Mayo if folks want to. How about we do the 12th that time? Let's do May 12th. Just in case, just in case.
Just kidding.
Okay, let's see, fee schedule. All right, Nancy sent around to us the next round of fees for us to discuss. And what you should be looking at, and I'll do like I did last time, I'll go through, does everybody have it handy? If you don't, I can go through the numbers as we talk. So we're looking at everything in orange, which is, oh, Devon, all your fun stuff, food stuff. So the first one is restaurant plan review. And it looks like currently Grafton is at 200. Millbury's at 250. Auburn 150, Northbridge 300, Shrewsbury 200, and Sutton 240. That is restaurant plan. There's a separate one for residential kitchens. Any thoughts around that?
It's quite involved, Jen, when you do a restaurant plan review. Yvonne, you agree with me?
Yes, it is.
Yeah.
Talking on mute. I think we've tried to be mindful when we increase to not go up more than 50 to 100 if we do increase the fees. So just considering that Millbury's at 250, Shrewsbury's at 200, Sutton is at 240, and Northbridge is at 300. Any thoughts on increasing to 250? Yeah.
Yep, that seems reasonable to me. Unfortunately, I can't pull up the list here on my other device. So I don't know that I can make the motion, but I would suggest that we go to 250 on that particular one.
Would anybody like to make a motion?
I don't think you need to make a motion.
Oh, we don't have to?
No, you didn't last time.
Yeah, I thought we did, but
I thought we did too.
Okay, go ahead.
I said,
If
"Oh,
we don't do
did."
it, you're gonna tell me I gotta do it next time. I just know it.
I thought we did. And Nancy, before we start doing any motions, for all of these, they're all, well, I shouldn't say they're all because it depends on like what we're getting through here, but like they're either like one-offs or they're like 1 year, like annual ones.
Right.
Not something that's like a 2 year or something.
No, these are all yearly, January through December.
And for the restaurant plan review, is it when a new establishment opens or every year they have to present the plan?
A new establishment opens or they renovate,
Okay.
major renovate.
Gotcha.
And then one other point of this, not discussion as such, but another topic of clarification before we get to any of these and stuff is for whatever we do with these, is the plan to make them so they're applicable this upcoming January 1st?
I think that's what
Yeah.
we're doing with these.
I would think so.
Messaging as we decide, so they have a little wiggle room. I will just note that the current 200 that we're at is the same as what we're charging for a residential kitchen plan review right now. If that helps. And some places are not charging that at all. Some have a lower one has a lower, one has a higher fee, and then some have nothing. So, you know, that just a restaurant seems like they maybe should have a higher fee than a residential. Go ahead, Dan.
Yep, I did bring up my fee schedule graph here, so I would like to make a motion that we increase the restaurant plan review from $200 to $250 for the year coming up starting January 1st, 2025 through December 31st, 2025.
Second.
Karen, I'll second.
Thank you. Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Gwiazdowski, Govin, aye.
Ben Maynard, aye. And as I alluded to, the next one is the residential kitchen plan review. One town, let's see, Millbury has 250. And they have 250 and 50. They have two separate fees. And then Auburn, it doesn't look like anything. Northbridge, Shrewsbury, and Sutton have nothing. Yeah.
Okay, if you don't mind, I'm going to jump in and say I don't think we should change that that fee. If anything, we could go down, but at this time, unless anyone else wants to pipe in and discuss it, I think we should leave the residential kitchen plan review fee at $200. I'd like to make that motion for the year 2025.
Jen, we don't actually have these residential kitchens do a plan review. Devon will go out and inspect. And it's more of a one-on-one because it's just your kitchen.
Right.
And
But
that's
the fee,
only-
but we have the fee, right?
Excuse me?
We do have the fee though, right?
Well, Devon, I don't know the last time you did a plan review for a residential kitchen.
No, and the last time I did a residential kitchen inspection, it was just an inspection. There was no plan review at all.
Right. We don't charge for residential kitchen.
Okay, I'd like to retract my motion.
Well,
Uh,
1 second, Dan, sorry.
Sure.
Nancy, just to clarify though, the fees that we have in orange here listed in Grafton are those existing or are those proposed fees that you're proposing?
Those are existing.
Okay, so just to know, we do have it listed here that we would charge a residential kitchen $200 for a planned review.
Right.
So,
That
in this-
was already on there from the other towns.
so in discussion, I
something-
think we should either reduce it to 50 or eliminate it. I don't know what everybody else thinks before I make a motion.
The only question, this is Karen, the only question I have is it possible that the other towns have it lumped in as part of their restaurant plan review? I'm just hypothesizing.
And Millbury has 2 separate fees, so I'm not
Yeah,
sure.
and I could be totally off base. I'm just, it seems odd on one hand that like no one else, but I don't know.
Yeah.
I didn't put the chart together. That's why I'm asking before we go and do anything.
Good question. It's a good call out. Do we want to pause on making a decision on this one until we can just maybe clarify with maybe Devon or Nancy? We can call a surrounding town and just see what they do with residential plan, if they do a plan review or do they charge for the inspection? Just so
Sure, I think we should pass on this one. This is Dan.
we'll leave it as such, and then if we can get a little information for next time, we can decide if we want to make a change or not.
And
Okay?
usually, I just want to say, if there is a plan review for a residential kitchen, it'll be if you're actually adding an actual addition that would be a kitchen to your residence, and it would have to be inspected to make sure it meets all the requirements of a kitchen based on what you're going to be doing in the residence as far as when it comes to food. Then we would have to do some sort of review, because there's certain things you would need to be considered somewhat an establishment in order to do any food preparation. But other than that, as Nancy stated, it's just like me walking into my kitchen when I do a residential kitchen inspection, checking your fridge, making sure you have a stove, making sure all items you're using for your business are separated from your personal food items.
Got it.
Yeah.
Right. Yeah, so I guess if we can get some info on, if, to Karen's point, they just treat them all the same, then we can, consider if that's what we would like to do, if we want to do any kind of distinction.
Okay.
Yeah.
Yep, sorry to be so forward. I'm just getting hungry. No. So anyway, if we could pass on that one, the next one, it jumps out a little bit and looks to me like we should increase the one-day catering to $100. And if anyone disagrees, we can talk about it, but otherwise I'll make a motion to that effect.
Yeah.
Okay,
it's
Dan, before you make a motion.
Go ahead, Nancy.
Beth and I went over these today, and we don't do a one-day catering. We
Okay.
do what's called a one-day food permit.
Yeah. Yeah.
I can show you which ones they are.
So didn't we adjust those fees recently? I thought-
One-day food permit. Where are you?
I thought we did that.
Well, right now it's, right, it was 10. I think last year you went up to 25. So Beth and I have in here 30 to 50.
Okay, and further down, there is a temporary food one day, which is also 25.
Right.
But that being
Yep.
said, if you don't mind, I would like to make a motion for the one-day catering to be at $50, go to a $50 fee.
Is there a second?
I'll second that.
Roll call?
Dan Finai.
Bill Muller, aye.
Karen Gosesky, over 9.
Then Maynard, aye. Great, Thank you, Dan. Food establishments, and then it goes from 0 seats, 0 to 50 seats, 51 to 100 seats, and 101 to 150 seats, and then up and up and up. And so it
Oh.
looks like,
So the
um,
gray section
yeah.
is what, I just lost everything on my computer.
Oh, I love technology.
Hold on, here we go. So the gray section,
Ah.
we want to eliminate altogether and just keep it as is. Oh, I gotta put my password in.
So regardless of the seats,
You want a food establishment at 100.
Keep it only at 100.
No,
Increase it, but
okay,
regardless of the seats.
let's, all
Okay. So yeah, so like some other towns where they,
right, so see where it says food establishment, 0 seats, take out the 0 seats and just do food establishment, which is also a retail permit.
Oh.
So I'm gonna add the word retail, and right now it's 100. And the other towns are pretty high.
Yeah, we've got Millbury is at 100, Auburn 225, Northbridge 250, Shrewsbury 400, and Sutton at 300. Did you and Beth have a thought on how much you would want to go up?
well, this is Karen also while you're thinking about that, Nancy. Like currently we're just like one flat fee regardless. But if you look at the other towns, they might be, you know, $225 for X to Y seats, and then it's $325 for above Y to Z plus seats,
Yeah,
or something similar where it starts off at 300, then it goes to 360, then it goes 600, 600, 600.
Is
So
it-
it's-
is it additional work for you all in Devon if there's more seats? Or is the work the same? It's just the size of the establishment?
Well, I don't know, Devon. I mean, we don't have anything over 150, right, Devon?
right?
That's right.
We do? No, we don't.
We don't.
not at this point in time, no.
How does 250 sound across the board? What do you people think about that?
Yeah, I mean, I think if we're looking to
We're
be,
gonna go from 100 to 250.
Yeah,
or we could do 200, and that way it's we're not really going over that $100 addition year over year. Because we're gonna look at these annually now, right?
oh yeah. Right. So maybe 200 or 225?
I would be okay with 200, I think, and then
Okay.
if
Yeah.
Nancy, if you guys want to consolidate the seats, I guess consider, you know, if it's more work for you all, if you want to continue to break that down.
One, like we're doing it now. Book 200.
And just leave it
Yeah,
broken
that's
down
good.
for now.
That's just a flat rate, right?
Right.
Yeah,
I've already sent emails out to everyone that fees are going up.
good. Dan,
So Dan, again, I'd like to make a motion that we increase the food establishment and retail permits for food from $100 to $200 per year, starting in 2025,
for all
Great.
seat levels.
regardless of the seats.
Second. Is there a
So-
second?
Karen Gostowski Govan, second.
Roll call?
Dan Finn, aye.
Bill Muller, aye.
Karen Gostowski, Gilvin, aye.
Jen Maynard, aye. All right. I know you're hungry, Dan. We have a
Yeah.
couple more left.
I gotta go on mute so you can't hear my stomach growling.
All right, bakery
So
permit, go ahead.
we don't have a bakery permit, we don't have a deli permit, and we do not have milk and cream, because those are included in the fee for the food permit or the retail permit.
Okay, so the milk and cream and frozen. So on our list, it does look like bakery and deli, we have $100, but what we're saying is it's included in that other fee.
Correct. It's included in the $100 fee, so now it will be included in the $200 fee.
Okay. So I don't think we need a motion for that. We can just put all those in parentheses or something.
Yeah, and maybe just bakery and deli to also put included in $200.
Right.
Yeah. Oh, even better. Let's see. Temporary food 1-day permit. We have it currently at 25. Dan, I know you have a motion on this one.
Well, yeah, I'm wondering. I guess we should go to 50. I just can't remember what we did with the 1-day catering thing. So anyway, I'd like to make a motion to move the temporary food / 1-day permit to $50 from $25 for 2025.
Second,
This is Bill Muller. I'll second that.
roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Gostowski, Gilvin, aye.
And Maynard, aye. Okay, mobile food permit. We're kind of almost there. Mobile food permit is $100 currently. Surrounding towns, Auburn is $150, Millbury $250, $150 for Northbridge. Open space. Where's
Yeah.
this?
Yeah, food trucks have gotten pretty popular lately. And if that's an annual fee, I think we could easily go to 150 and perhaps 200. I don't know what everyone else thinks.
Nancy, we didn't increase these already. This is separate from like the farmer's market and stuff like that, right?
That is correct, yes.
It looks like if we raised it up to 150, there would be 3 out of the communities that are at the same level.
Right.
And 3
Yeah.
are higher.
And what was Shrewsbury? Yeah, including Shrewsbury, I guess. So this is Dan. I'd like to make a motion to increase the mobile food permit, the annual permit, to $150 from $100 for the year 2025.
Is there a second?
This is Bill Muller. I second that.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Gostowski, Gilvin, aye.
Jen Maynard, aye. All right, semi-public pool permit and the plan review. It looks like currently.
Jen, can we go back to one?
Yeah.
Before we leave food, the one up top, the 1-day catering,
Yeah,
that's a 1-day permit. Just what you voted on, 1-day permit,
same thing. Yeah,
$50. Right,
correct.
so we don't have that listed on the food permit. So I'm just gonna take it off this list here. Because it's a 1-day permit,
Sure.
whether it's catering, well, yeah, most of them actually are catering.
Yeah, that makes sense from an administrative standpoint. So I don't think anybody's going to complain about that.
Okay, so that will be 50 now. Okay,
Then we have semi-public, public pool permit, and then the pool plan review. The permit is 100, and then right now there's 0 for the plan review. Currently, there is one town also at 100, one at 120, and then the other 3 are at 200, 250, and 250.
Jen,
Go ahead.
the 100
Yep.
is Oasis, their spa,
Mhm.
and it's actually $50 for the pool at Point Rock Early Learning Center. And special purpose food, was she's again at spa. What does she have?
She has a submersion. Well,
What's it? Oh, I can't
it's like
think
a
of the name of it.
submersive pool. She doesn't have it right now, but does usually.
A float tank.
Yes.
Float tank.
So did you say that those are 50 or 100 currently?
Okay, so the spa, which is Oasis, right now is 100.
Yeah, and then the others are 50.
And we're looking at, Beth and I went over that, to 150.
You were thinking about going to 150?
Yes,
What you suggest.
Got it. And that would be for all of them, despite what kind of pool it is. Body of water. Body of water. All right, is there a motion to entertain the 150?
To 150 was what we're talking?
Yeah,
Okay, yep, this is Dan Finn. I'd like to make a motion to increase the semi-public / public pool permit to from $100 a year to $200 a year for the year 2025.
no, I think it's to 150, 100 to 150.
100 to 150. Yep, 150.
This is Bill Muller. I'll second that, the 150.
Roll call?
Dan Finn, aye.
Bill Muller, aye.
Karen Gustafsky, Governor.
Dan Maynard, aye. And then you have the pool plan.
That's a yearly. Now
Right.
you've got the other two that right now we charge 50. What would you like to go for those? That's the Learning Center outdoor pool and Point Rock Estates.
So how come
That's
they're charged?
seasonal.
How come they're charged differently if we have it as semi and slash semi-public / public pool?
Gonna open up the permit because I just right now can't remember.
If we could put them all under the same,
Yeah,
I mean,
yeah.
because
Seems to me we should keep them all at 150, even though it's a jump from 50 for those two places. Like what I think.
yeah, it's still open to the public, even if you need like an appointment, and it's probably smaller scale than like a public pool. It's still same concept.
Do you want to go from a yearly permit? You have to charge the same fee for a seasonal permit, from 50 to 150.
Well, we don't have seasonal rates here. We just have this one line, so.
Okay, so it's not written in here, but that's what it is. Here we go. Right, so the hot tubs of right now are 100, and all the other pools, 50, 50, 50, and Oh, okay, I'm sorry, Truth Organic Spa, hers is also 100. So it's on the actual application. It deciphers whether it's seasonal or yearly. Not on this, what the chart you're looking at, it's on the application.
Okay. This is Dan again. I would like to make a motion that we move the seasonal pools to $100 from $50.
Second,
This is Bill Muller. I second that.
Dan Finn, aye.
Bill Muller, aye.
Karen Gustowski, Governor.
Jen Maynard, aye. Thank you. Okay, then there's a pool plan review that it looks like we currently have a $0 fee.
Because we don't have one.
Right,
Devon, do the other towns have one?
All right.
yeah, they range from 150 to 300.
Devon, I don't remember having one.
I've never had to do one, but West Boylston and Shrewsbury has it on their list of fees.
Yeah, I think the last time we had a plan review, aka some type of pool spa type thing, come in for the first time probably predates Devon. Because even
Oh,
Truth,
that would have been
theirs,
the
like
front.
Truce would have predated, I think, him also,
Mhm.
and then the other three definitely.
Yeah, I mean, I yield to whether or not Nancy and Devon, do you all think we need to establish one? And if we do, maybe we started at 50 since our fees are just going up to 100 and 150 here.
You're going from 0 to
50.
50. Just where we are only at 100 and 150 for the actual fee itself. Would anybody like to make a motion to establish a $50 fee for a pool plan?
This is Dan. There is a football game coming up tonight, by the way. So anyway, I would like to make a motion to have a semi-public / public pool plan review, establish a fee of $50. I don't know that would be annual. I guess it would be annual, but I don't think they have to do it more than once. Anyway, $50 is what I make a motion of.
Is there a second?
This is Bill Muller. I second that.
Roll call?
Dan Finn, aye.
Bill Muller, aye.
Karen Gustowski, Governor.
And Maynard, aye. Okay, last one.
I was only kidding about the football game.
You're hungry, you're football. Let's see. Tanning plan review and tanning establishment. So this is another one where it looks like we do not. Maybe I'm hungry. I'm talking about donuts. We do not have a fee, and we range from 120 to 150 in 3 of the other towns. And then the establishment fee is 100, with one town doing a base fee plus $20 per bed, then ranging from 100, 150 to 200. So guess first is a planning review, given we don't have one and we're at 100 now with the establishment. What do we want to establish a plan review fee of $50 perhaps? And we're actually pretty on par with the other towns with what we're charging now, except for, one that does the $20 per base. I wouldn't think that we should go up any more than 50 on this, but even that, maybe
Yeah.
125. I don't know that we have very many of them in town.
So you're thinking 100 or 50?
Maybe 50 for the plan review and either
Yeah.
keep at 100 for the establishment or only
Yeah.
go up to like 125 or something.
Okay, well, this is Dan. I'd like to make a motion to establish a tanning plan review fee of $50.
Is there a second?
This is Bill Muller, I second that.
Roll call.
Dan Finai.
Bill Muller, aye.
Karen Wasowski, Governor.
And Maynard, aye. And then the tanning establishment, looking at it's 200 or 100 per $20 bed, 100 base, $20 per bed. We are at 100. The next town is at 150, and then the next is at 100. And so I feel like we're fairly comparable. Do folks have thoughts on if we leave it or go up to 125 or 150?
This is Dan. I'd like to make a motion to, let me find it here, increase the tanning establishment fee to $125 per year, starting in 2025.
Is there a second?
It's Bill Muller, I second that.
Roll call.
Dan Finai.
Bill Muller, aye.
Karen Wasowski, Governor.
Jen Maynard, aye. Phew. Oh, Nancy. These Monday meetings and fees. All right, that is our fee schedule work. We have a couple of sets of agendas to our minutes to tick through, hopefully quickly. And then we're done. For minutes, April 6th, 2020. I think that would be Karen and Dan primarily here.
Karen, I don't have that list of stuff. I don't know if you don't mind.
Yeah, I've got it. I'll make a motion to accept the April 6th, 2020 minutes as written.
Second,
This is Dan Finn. I'd like to second that motion.
roll call.
Karen Wasowski, Governor.
Dan Finai.
Jen Maynard abstain.
Bill Muller abstain.
You. May
can-
4th, 2020.
Jan, excuse me, you can make the motion because we need it. We need the vote.
Wait, what?
So we need to have a quorum of voting. And 2 is not a quorum.
That's right.
I need, right, it happened once before. Yep,
So the April 6th and the May 4th, we can't vote on then.
yes, you can. You can't make the motion.
I did.
Neither can Dr. Muller.
Karen,
Right.
Karen,
I made the motion.
Yeah, Karen did it. No, I know.
Yep. so we're good.
Right, and then Dan. And then roll call vote can be all of you.
Oh, we can vote. Okay.
Well, I
That was,
wasn't there.
I thought we couldn't vote. We do this every time.
Karen,
That's because you had 5 people. You've always had 5 people. Now you've got 4. So there was one of you that abstained when you had 5.
Karen, you want to make the call on this? I think,
I
How
checked
about
with
we-
town clerk.
How about we do this? Let's hold off on April 6th and May 4th and just get confirmation from the clerk on how we should handle it.
I did,
Oh,
I
I
got
know.
confirmation.
I know, but Bill and I have never voted on something that we've never been attending to. So can we just get it in an email from her so we have it?
Sure.
Great, thank you. But that's okay, because we have 3 more and we're all there for these. So May 2nd, 2022. Is there a motion to accept those minutes?
This is Karen Wasowski, Governor. I'll make a motion to accept the May 2nd, 2022 minutes as written.
Second,
Bill Muller, I'll second that motion.
Roll call.
Karen Wasowski, Govan, aye.
Bill Muller, aye.
Dan Finn, aye.
Jen Maynard, aye. July 15th, 2024.
Karen Wasowski, Govan, I make a motion to accept the minutes of July 15th, 2024 meeting as written.
Second.
Bill Muller, I second that.
Roll call.
Karen Wasowski, Govan, aye.
Bill Muller, aye.
Dan Finn, aye.
Jen Maynard, aye. And August 5th, 2024.
Karen Wasowski, Govan, I make a motion to accept the meeting minutes of August 5th, 2024 as written.
Second.
Bill Muller, I second that motion.
And roll call.
Karen Wasowski, Govan, aye.
Bill Muller, aye.
Dan Finn, aye.
Jen Maynard, aye. Phew. All right. Thanks for playing today, all. Would somebody like to make a motion to adjourn this meeting? Dan Finn, do you have a motion?
I would like to make a motion to adjourn this meeting of the Grafton Board of Health.
Is there a second?
This is Bill Muller, I second that motion.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Wasowski, Govan, aye.
Jen Maynard, aye. Whew. Thanks all. Lots of
Yep.
things accomplished today. Appreciate all your work.